Kap, dami kong kasong sprains and strains. Ano nga ba yun? Anong difference nun? Kasi diba, usually yung mga athletes, sinasabi nila, naku Rina, may strain ako, hindi ako makakapaglaro. Hamstring strain, ayan. Yung iba naman, puro sprain. Ayan.
Okay.
And it's common, di ba? Yung para bang it's so simple as natapilok ka lang, you're like walking, tapos uneven yung ground, tapos mapapatapilok ka lang. You can already
So ano
have
yun?
that.
Sprain or strain?
Sprain.
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 Ay, tama.
Yeah.
Good job.
Ano ba ang difference?
Hindi expected kasi ngayon summer eh. So
Correct.
a lot of kids who are out of school are indulging
Into sports.
Sports,
Like yung
outdoor
mga sports,
activities.
summer clinics,
Yes.
usong-uso yan.
Oh, yeah.
Tapos yung mga tayong mga trying to be fit at para magkaroon daw ng summer bod, ay, ayan, nagtatatakbo, nagsisports. So, kaya uso siya or common siya kapag summer. So going back, ano ba ang difference ng sprain sa strain? When I was a student, the way I would remember it is yung
Ligament.
strain may letter T.
Tendon.
Tendon, which is from a muscle. So basically, yung strain na tinatawag natin would be
Muscle.
injury to the muscle. Yung sprain naman is injury to the ligament. Yung ligament, ano ba yung ligament? Yung ligament ay nagko-connect ng isang buto sa kabilang buto. So it maintains this stability of the joint. So yung itong nasa ewan ko, pakita natin sa screen. So yung nasa
May
screen
anchor.
natin ngayon, meron tayong tinatawag na mga medial ligament, lateral ligament. Maraming ligaments actually ang mga joints natin. Now, the ligaments would maintain the stability of your joints. So kapag kunyari ikaw ay natapilo, katulad ng kinwento ni Will kanina, pag natapilo ka, what can happen is either mas-stretch or mapupunit yung ligament mo sa whatever joint na affected. So kung tapilok ka, ankle yan. Now, depende yan kung paano ka ba natapilok. Yung iba, nagkakaroon ng inversion injury or napapaganon. Yung nandito sa picture sa ating screen, on the left side of the screen, yan yung inversion. And then yung kabila, eversion naman yan. So kapag depende kung anong ligament yung affected.
Pwedeng lateral or
Medial ligaments.
malleolus.
Oo. Ngayon, kung kunyari sa tuhod naman, dito natin naririnig yung mga MCL, LCL, ACL, PCL, yan. So, yun naman yung mga ligaments na yun. Sa football, common ang mga ACL injuries, MCL, PCL, LCL injuries. Kasi yung buong lower extremities nila, so normally yung mga tuhod nila affected.
Doc, anong manifestations kapag ikaw ay may sprain? Yan. Bago tayo dumako sa strain.
Sa sprain, commonly ang nangyayari na first, obviously, pag natapilo ka, ay di may pain. Ngayon, I normally tell the patients, tingnan mo kung anong part nung katawan yung masakit. Pwede mo siyang i-pinpoint eh. If the area of the pain is more in between the two bones, or yung sa soft part in between, ligament yon. Pagka hinawakan mong ganyan, tas na-feel mo na nasa parang buto siya, baka may fracture ka na o may pangatlong entity pa yung fracture. So, one would be pain. The second one would be maga.
Swelling.
Mamamagayan siya. Now, the swelling can occur minutes to hours after the injury. So, hindi porke ngayon ka natapilok, bakit later on pa ako nagkaroon ng swelling? Pwede pa rin mangyari yun kasi nag-accumulate yung fluid or yung hematoma or yung blood.
Redness, Doc. Meron ba?
Yes, minsan na dahil sa namamaga siya, pwede siyang mamula. Or later on, pasa. Nagkakaroon siya ng pasa. So actually, ganun din kapag strain. Yung strain would feel, what one person or one patient would feel would be, para siyang
Napunitan.
sinuntok. Yun yung common na Dok, para akong sinuntok dun sa para akong sinuntok dun sa, like normally dito yan sa calf muscles. Yan yung mas common. Dok, parang may sumuntok sa akin dun sa calf muscle ko. And then, pag kinapa mo siya, may certain area kung saan dun very tender. Dun sa muscle belly. So, yun, ibig sabihin nun, na-injure niya yung muscle. So, it's either na-stretch niya ng husto or napunit din niya yung muscle. So, it can also manifest with pain, direct tenderness over the area, pwede rin magka-swelling, pwede rin magkaroon na naman ng pasa or bruising.
Is it the same management, yung RICE na tinatawag natin?
Yes.
Rest, ice, compression, elevation?
Correct. Yun, ganun pa rin. So the first aid would be you apply ice. Well, obviously, you stop whatever you're doing. Pahinga mo na siya. And then you apply ice over the affected area. It can help if you have like elastic bandage or compression bandages or yung mga compression sleeves na tinatawag. You can apply that, you can wear that. Then you elevate the area to prevent further swelling from occurring.
Pero can a sprain rather or a strain, pwede ba siyang maging recurrent? Like
Yes.
if you sprain your ankle really bad, there's a chance na hindi na siya mababalik or
Yes.
magiging problem area siya like if you're
Yes.
parang Achilles heel,
Recurring.
parang ganon.
Well, I
Recurring
normally
injury.
tell my patients, once a sprainer, always a sprainer. Kasi the reason will be, para na-sprain mo yung area, like say your ankle, it's either nga na-stretch mo lang gusto yung leg, parang alam mo yung goma, yung elastiko, yung rubber band. You keep going like this. If your goma is like this and then you keep pulling it, if you let it go,
Magbe-break
hindi
siya.
na siya bumabalik dun sa original na size niya eh. Normally, nag-elongate or nag-expand siya ng konti. So, parang ganun yung sprain. It's either nga na-stretch mo siya ng gusto, it will heal. Hindi pa rin siya punad, pero mas mahaba na siya compared dun sa isang side. So, mas maalog na siya ngayon on one side. So, ngayon, kakaalog niya, kakatapilok mo dahil nga maalog na siya, nagiging recurrent ngayon yung injury mo.
Di ba may mga sprain na manageable kahit 2 weeks lang, di ba? Pero kapag ikaw ay may grade 3 sprain, gaano katagal yun, Doc?
It depends on, well, number one, yung katulad ng sinabi mo, depending on the grade of the sprain, depende rin dun yung management. Kasi kung grade 3 na yung sprain mo, minsan kailangan mo na isemento.
Ano yung pagkakaiba? Grade 1,
1,
grade
2, 3. Okay, pag 0, walang punit yung ligament.
Okay.
Stretch lang. Pag grade 1, less than 25% of the ligament is torn. Grade 2, more than 50%. Grade 3, more than 75%.
So mag-graduate ba yan sa high school?
Kapag
Pwede rin.
paulit-ulit kong pwede. Pwede siyang gumraduate sa high school.
Kasi nadulas ako sa banyo.
Yes.
And parang I think ngayon,
Namamaga?
oo, di naman, pero parang I could walk properly. Kaso parang medyo...
May certain motion.
Yeah, hindi ako makatakbo ng maayos. Is it dapat ko ba itong i-wrap nung Kasi sabi ng nanay ko,
Ice.
magsaklay daw ako. Parang ayoko nun. paano yung
Nakakalakad
kami dito,
ka pa
di
naman
ba?
ng normal.
Actually, yun. The use of crutches depends on the grade of the sprain. So if I see the patient na talaga naman, you didn't see me last year, no? I was using a crutches already kasi sobrang...
Dito?
Yeah.
Wow.
Kasi sobrang namagana talaga yung ankle ko. I fell off the stairs and twist ko siya.
I
So
saw
sobrang maga yung ankle mo, tapos painful siya to step on. Pagka ganun na yung paa mo, ay, kailangan mo na yung pa-x-ray at siguraduhin wala kang fracture and then you use crutches to avoid putting weight on it because that will help you heal faster.
So should I walk normally o dapat i-ganyan-ganyan ko? Kasi
Nakakalakad ka naman ng
Ako, I would
normal
say,
eh.
medyo masakit. Pero
I would
carry
still say
naman.
try to walk as normal as you
Yeah.
can.
Kapag wala namang discoloration namong dito, okay lang
Yeah.
Kasi dati nag-purple eh. Akala ng nanay ko nilagyan ko na eyeshadow. Para hindi lang pumasok. Sabi ko, totoo yan.
Pero yung pain ng sprain is very painful. Ibang klase.
It depends on the grade.
Yung ACL, I think it's very painful.
Yes.
On the
Yun
injury,
talaga.
at the
Sa
time
knee.
of injury.
Yeah.
Pero after that, hindi na siya painful. So if you've had an ACL injury like 3 years ago, I wouldn't
Wala
be
na.
expecting na masakit pa yan siya ngayon.
Stiff
Your
neck.
complaint would be instability.
Instability. Yeah. Tsaka, di ba, can you explain on that na parang ang sinasabi nila, kapag na-sprain ka, kunyari on your right leg, mas prone ka na rin sa knee injury on your right leg at the same time on a hip injury,
Kasi
di ba?
hindi na, kumbaga your other joints are compensating. And kung hindi na stable yung isang part,
Open kinetic chain, di
oo.
ba?
So basically kasi, magiging unstable na rin the other parts kasi hindi na siya yung kinetic chain mo, hindi na siya normal. Biomechanics mo, hindi na siya normal.
Doc, may question ako. Balikan natin in question kasi about sprain naman. Strain. Ito yung sa muscles. So usually kapag kumwari ba, correct me if I'm wrong, kumwari sa gym, nasobrahan ako sa pag-workout, pinush ko, pwede bang maging cause yun ng
Oo,
strain?
lalo na if you're performing it haphazardly or yung hindi proper yung execution mo ng lifting, yung makabuhat lang. Yung gano'n. So, pwede mong ma-injure yung muscle na talaga.
Tapos, ang follow-up question ko, kasi merong nagsabi sa akin na kapag daw kung wari sumakit, parang i-push ko ba daw? Kasi parang sa umpisa lang daw yon dahil
It
hindi
will
sanay.
depend
Oo.
on what kind of pain. Kapag yung pain mo nawala with rest,
Okay lang.
pero kung kunyari, every time you're moving it, it's more and more painful,
Then you should
Hindi na
stop.
siya okay.
Pero,
Check mo
pero
siya.
I have something to wrap that up. I think no, since sprains and strains are basically because of strenuous activity, dapat talaga mag-stretch ka before.
Ay, yes.
That's parang iwas yun. That's more
Actually, before
preventive.
and
No?
after.
Warm up, for me, warm up is a very important
Okay.
part of like an exercise
Before and
regimen.
after naman yan.
Warm
yung
up and cool down. Kasi lalo na for the runners here, na kasi wala naman tumatakbo ng tanghali eh. So normally they wake up early to run. Isipin nyo na tulog yung lahat ng muscles, so
Tulog
bigla
pa.
kang tatakbo ng 10 kilometers, diba? So it would be good na you walk a little bit muna and then you start stretching and then saka ka mag-run. Kasi nawa-warm up yung muscles mo. Kasi otherwise, nai-increase yung chance of you getting a
Getting
muscle injury or even sprains with yung mga ganun.
Ayan. So, ang dami natin natutunan again from
Yes.
Doc Janis. Lalo na sa mga sporty at sa mga sa mga may anak na gusto ipasok yung kanilang
Sa
mga
summer
chikating
workshop.
sa mga sports and summer
clinics.
workshops. Thank you so much,
You're
Doc Janis.
welcome.